welcome to the Great Unicorn. As you know, we conduct interviews with the founders of the most promising startups who have the potential to become the next unicorn. And today we have with us is Mr. Malay Dixit from Piscium. Welcome, Malay.
Hi. Hi.
Okay, so before I jump on to the rapid fire questions, why don't you tell me a little bit about yourself, what you do?
Okay. We are Team Piscium, Piscium Health Sciences. We make dental and medical devices. We are supported by BIRAC, Sign IIT Bombay, angel investors, and friends and family. We research, we develop, and commercialize our products, and want to be an idea magnet for transforming R&D into dental and medical innovations. My name is Malay. I'm from IIM Lucknow, PGDM in 2001. Worked for about 20 years in sales and marketing. Experienced in R&D, innovation, that's my forte, and business management, of course. My co-founder, Dr. Trupta, is an MD DNB. She's an obstetrician and a gynecologist. Has over 2 decades of experience in the medical field. And Anil, our plant head, who joined us in 22 this year, is a BTech from Government Engineering College, Thrissur, and has a rich 30 years of experience in engineering and allied fields. So yeah, together we develop, produce and sell our dental and medical devices. Currently, our dental burrs and dental alginates are out there in the market.
Okay, so let's just jump on to the rapid fire. And my first question for you will be, what are the pain points that you think and you're aiming to solve?
Okay, so India has a very big dental problem. We are the biggest dental markets. It's valued at $932 million, and yet underserviced, underpenetrated, and everything is imported. Virtually everything is imported, and about 40 to 45% from China, from 20-25% from US, Europe, and another 20% from Japan and Korea. And all quality of goods are not that consistent, so to say, and that's the pain point. One of the prime causes of pain or in suboptimal treatment is inefficient dental materials. Take the example of dental burrs, composites or root canal files in India. Same scene. The Indian dentist spends about 40% of his earnings on consumables and needs good quality at optimum prices. But yet he does not get any guarantee of what he is getting. Since such products are extremely nuanced, on the other hand, Indian players want to, they prefer trading or repackaging imports. And Pisum stands out in this context. We develop our products. We will soon export them. The need gap in this context is an R&D-led Indian company which continuously develops and manufactures world-class dental solutions, and indeed lead the export brigade of this country.
Sure. And given your pain points and as well as your vision, why do you think what you're doing is working?
Okay, when we started off as bootstraps, there wasn't any money for tech transfer or expensive consultants. All that we had is some science in our minds, some ideas. We approached top notch experts from IIT, from ICT, my alma mater, and the industry for help. And turns out that the network that we developed then, and the experience and the ability to pick up a problem, build up solutions from bench to market, have indeed become our USP. Some of our processes have been built learning from different industries like semiconductors and heavy industries. So yeah, that's our USP. We are able to develop products from ground zero. In fact, we observed that the more systematically and scientifically we approach a problem, the faster we are able to develop solutions. So that's what's working for us. That's what we think that what we're doing is working actually.
Sure. And what do you think are the upsides, like logically speaking, and as per your wildest dreams?
Okay, if we only target the domestic market, yeah, 10 products developed in house, then we are discussing a revenue of 133 crore rupees in by 26-27, let's say 5 years from now, and an EBITDA of 76-80 crores. This includes exports starting from year three. Now, if we go by the performance of global giants like Zimmer Biomet, Henry Sheen, the scale at which they operate, they're 7 billion, 11 billion dollar companies. So they have got a global footprint, we can have it. Uh, they are into dental devices, they are into medical devices. We can do that. So though it sounds that wild, it's very much possible that we become a 10 billion company in the future.
Sure, I hope so. And again, good wishes from my side.
Thank you.
Again, just like for our investors to know as well as our viewers to know, why do you think and what do you think are the risks in the business that you're in?
The biggest risk I see is the import dependence of high quality commodities, like the quality of metal that is required to make a medical device, the quality of actives, for example, alginate required to make dental alginates. That's really import dependent, and there's a double whammy to it. There's a dollar value dependence, and then there is the availability of raw materials as such in a volatile market or a volatile situation where, like for example, during COVID times, there was no supply of diatomaceous earth. All mining activities had stopped. So that's the big risk over there. While the vendor ecosystem in India brings up very pleasant surprises, I must say, but there are these raw material manufacturers which can really upset the apple cart. And the more vendors we develop in India, work in a partnership kind of a development, the lower the risk. Another risk is cost of litigation in this business. And I believe if you sincerely adhere to the regulatory framework, then this risk is largely mitigated. But yes, that risk exists in this sector, so to say.
Sure. Like if now you have to give quickly the TAM, SAM, CAC about the whole initiative.
Okay. Um, there are about 300,000, that's 3 lakh general dentists in India and 40,000 specialists. Out of this, 65% practice independently, rest of them in institutes. 80% of the business is located in 5 metros and next in 40 towns. And these towns are seeing the fastest growth. The Indian dental consumables market, as we said earlier, is $932 million, growing at an 8% CAGR. Global dental consumables are valued at 300 billion per annum, and global medical devices at 900 billion. So that's the potential of what we can tap. That's the potential of products that we can get into. Piscium is starting with dental devices and then plans to expand in both the geographical footprint of our dental devices as well as into medical devices.
Sure. And any of the customer testimonials that probably you'd like to share with us?
Sure. So let's start from DPI. They are the biggest customer for Burst. They keep looping back market feedback and push us to develop more and more designs. More and more types of bursts come because of their market feedback, and I really appreciate them for that. Come to Alginate. Alginates, I remember being at an expo in Mumbai, and we had a live trial counter, and 90% of those who tried bought the product. Sales data, they ordered for it. Sales data is suggesting that our 3 month repeat rates are around 45%, and uh, that's heartening actually in this scenario. We are listed in Ames Raipur. We keep getting repeat orders from there. We are present in Rudrapur, in Kerala, in Chhattisgarh. So we've got a long way to go, but so far the traction has been good.
Definitely. Well, at last, I'll just like to ask you to give elevated tips that you want our investors to know.
Okay. So I'm Malay. I'm the founder of Piscium, and we founded a company in 2017. We research and manufacture dental and medical devices and aim to be a global player in the next 3 years. Currently, we have two products in the market, dental bursts and alginates, and a robust innovation pipeline. We are supported by Sign, IIT Bombay, by RAC, by angel investors, and by friends. Uh, we are clocking a revenue of 10 to 15 lakhs per month. Peers and distributors think of us as an upcoming and a promising company. Our operating profits are positive. There's an increasing demand for our product, but our capacity is concerned, and that's why constrained, and that's why raising the funds. I'm sure you have an array of wonderful startups to choose from. But if you are choosing to invest in healthcare, we are a good bet. Consider Piscium. We will make you and this country proud. Currently, we are raising 3 crore rupees for capacity expansion and an IPO in the next 3 4 years. We invite you. to invest into our business. Thank you.
Thank you, Malay. That was obviously a great pitch. And thank you again for joining us, actually. And as we say at the Great Unicorn Hunt, hope you get spotted and hunted really quickly.
Thank you. Thank you. Prithvi.
Again, all good wishes and all good luck to you.
Thank you. Thank you. Prithvi.